Siamo con il dottor Anthony Mollura da New York City in America. Ha presentato una relazione sull'autotrapianto nell'area temporale questa mattina. Buonasera dottor Mollura.
Buonasera.
Innanzitutto vorrei chiederle cosa ne pensa della sua presentazione di questa mattina.
Buonasera, grazie per l'invito. My talk this morning was on the establishment and recreation of temporal points. Temporal points is, in my opinion, a very important topic. Important for many reasons. Important because normally we all have temporal points, and as we lose hair, many people tend to lose their temporal points. They tend to recede back so that they become parallel with the sideburns. And if you don't reconstruct them, then you don't have the cosmetic results from a good hair transplants, because now they still look like they've lost quite a bit of hair, no matter how well you reconstruct their temporal, or rather their anterior hairline. So you could have thinning temporal area that you can fill, or you can have actually a temporal area that's totally missing that you reconstruct. You can use them for people that either lose them naturally or lose them because of trauma or because of burns and so on, or even because of other cosmetic procedures like facelifts where they pull back.
Yeah.
So there are many reasons, and I think it's a very important aspect to be able to build these points so that, and one other thing actually that's very important, which around the world many people use hair pieces. In Italian, I think you would say parrucchia, no?
Sì, parrucche. Parrucche.
Okay.
Toupee anche.
Toupee. Okay, that's the same as our language. Okay, toupee. Well, you can have a wonderful toupee, but if they're missing their temporal points, then it still looks like there's something wrong because you're not framing the face. So even in those people that do wear toupees, it's important to have that temporal peak or that temporal point.
Certo. La seconda domanda è più specifica ed è la prima persona a cui la faccio, il primo dottore a cui la pongo, ed è: utilizza Botox o filler in pazienti che hanno subito un autotrapianto?
Yes, that's actually a very important topic because, you know, we're in the profession or business of improving people's esteem, morale, feeling better about themselves. And many of the people that we see, the older people over the age of 40, 45, 50, and so on, who do have not only a hair loss, but also have a issue with wrinkles in the forehead or crow's feet around the eyes, or the glabella, you know, and they look angry. These people, not only, I think, in my opinion, do you want to reconstruct and give them a great hairline or give them, you know, the hair that they need to feel good about themselves, but then you want to also address other problems in the face that you can address. I mean, we've had doctors talk about doing facelifts or mini facelifts, and that's another surgical extreme. But I think at least to talk about fillers and to talk about Botox is a much easier way to go, at least initially, if they're not at that point of needing surgery. And it just complements what you're doing for their hair.
E l'ultima domanda
Sì.
è: quali sono i pazienti a cui sconsiglia l'autotrapianto, quindi di operarsi, e per quali motivi?
Well, you know, in New York City, I see many patients every day. And we have, from the general population, patients that come in that are anywhere between the ages of 18 to 90. And so there's a large population of people that come in with all different types of requests. So I, in many cases, won't do a hair transplant on someone who's too young, because if you're too young, and again, you have to look at the psychological component of that young patient. And when I say too young, certainly 18 is too young, and I think that medical treatment is the way to go for many of these young people. And sometimes, you know, today we're using more and more medical treatment, even in the older population. And now if they don't respond to medical treatment, then of course we do a hair transplant. But at 18, 19, 20 years old, we're not going to do a hair transplant yet because we don't know their genetic makeup. We don't, even though we get a good family history, we don't know where they're going later on. How much hair loss are they going to lose? But in certain situations where it's such a tragic, you know, psychological problem for some of these young people at 22, 23 years old, that I think if you use your judgment and they're missing, you know, their frontal hairline, as long as you don't go too low, that it would look normal in the future, you can do that. But unfortunately, a lot of people come in with unrealistic expectations. So to answer your question, if they have unrealistic expectations, then they're really not candidates because you can't fulfill that expectation. If on the other hand, they want the hairline too low because they may be 50 years old, they come in for a hair transplant, but they want to look like they're 18. Well, that doesn't work either because at 18 years old, you know, at 50 years old, you can't have your hairline down to here. So those are a couple of the reasons, and certainly that you have to keep in mind that you're there to help the patient. And if you think with your experience that what they're requesting is unreasonable, then I have no problem to say I will not do the surgery.
Penso che sia così per tutta la chirurgia estetica.
I hope so.
Avere troppe aspettative rispetto a quello che si può raggiungere.
Sì.
Grazie mille, dottor Mollura. Arrivederci.
You're welcome. Arrivederci.